Welcome, everyone. This is our weekly interview with our residents here at the clinic. And today we have Amber.
Hello.
And this is a chance to talk about cases that are perhaps difficult or to talk about our approach to various problems. So today I'm going to turn it over to Amber. And I told her she could ask anything, so go ahead. Let's hear it.
All right. Well, today we want to talk about treating low back pain and different images that you can use to treat low back pain, considering that's probably the number one thing we treat in our clinic and probably the number one thing most acupuncturists treat. I just would like to get a little bit of a better idea of your favorite image that you use for low back pain, considering we have so many choices.
Over the years, I've changed a lot in terms of sort of how I treat. And some of the changes are just a change, and others were, some of the changes were beneficial over what I used to do. And when somebody comes in with back pain, if it's chronic, and it's a typical lower back, it might extend into the sacral area, then I'm concerned about two things. I'm concerned about any joint problem in the facet joints, and I'm also concerned about muscle pain or tightness. So the very first thing I do is I treat the joint or the back joints. And how I do that is I choose a joint distally to the problem. My current favorite is kidney 6 area. If you needle just below the medial malleolus, and if you do it right, you can drop it 1.5 inch needles straight in there all the way. And you can do that on both sides, kidney 6 on both sides. You might have to use 2-3 needles on each side in that area, but you need to get into a joint area. Kidney is good because, of course, the lower back vessel is the kidney or Taiyang or Shaoyin. And so the kidney treats itself, and the kidney also treats Taiyang. So kidney 6, insertion into that joint is very, very good for lower back pain. So that's the first thing I do. And very often that takes the pain away completely. Just those 2 needles. So I'll ask the patient, how do you feel? It's better. How much better? It's 50% better. But the pain moved a little bit. Now it's not right on my spine. It's a little bit to the side of the spine. Okay. So then what I'll do is I'll add kidney 3, 4, 5, 3, 6, 7. I'll just needle up the kidney vessel. I don't pay a lot of attention to the actual points. I just want to make sure that I've covered about this far from kidney 3 up their leg. And why do I do that? Because I want to spread the image, because people are never totally accurate about where the pain is. They might say the pain is here, but I know, especially if you shoot a thermal scan, you'll see that the pain spreads over quite an area. So you have to make sure that you've covered the whole area. That's why it's a mistake, in my opinion, to just target the one spot where they say they experience pain, because it's never just one spot. It really isn't. So you treat the whole area, and for that I'll go up the whole kidney vessel. And then I'll switch over and I'll usually add the lung vessel, or you can add the small intestine on both arms. And I'll needle from lung 10, 9, 8, 7, 6, and I'll just go on up the arm, about halfway up. And I'll do that on both sides. And then I'll ask the patient, how do you feel now? And generally the pain's gone by now. If it's not, I will then pull up their shirt, expose their belly exactly above where the pain is, and I will needle quite a few needles above where the pain is in the lower back. But I'll needle into the belly. Then I'll ask them how the pain is, and generally now it's gone. If it's still not gone, then I'll add needles on the scalp, on the due portion of the scalp, usually from due 20 back. That's a very good image for the lower back. So I'll needle from due 20, and then I'll just keep needling like a mohawk back to the occipital protuberance. Then I'll ask the patient, how's the pain? It's almost gone, but there's this little bit. Then I'll add large intestine. I'll go to the large intestine 10, 11 area on both arms. I'll find a sore spot. I'll needle into that, and then the pain goes. It's that simple. And I do it over and over and over again. Will I change? Yeah, I probably will. Because you just get tired of something after a while, or some insight will come. But currently, that's what I'm doing. And that takes care of 98% or 99% of all the pains for the lower back. Okay? Thank you very much.